Hi, I'm Carla Angelica Pasmaicoto. I'm going to talk about immunotherapy in renal cell carcinoma. Definition. Renal cell cancer is a disease in which malignant cells form in tubules of the kidney. Smoking and misuse of certain pain medicines can affect the risk of renal cell cancer. Signs of renal cell cancer include blood in the urine and a lump in the abdomen. Tests that examine the abdomen and kidneys are used to diagnose renal cell cancer.
Renal cell carcinoma is the most common type of kidney cancer in adults. It accounts for approximately 3% of adult cancers, and the incidence has risen steadily by about 2 to 4% each year in the past few decades. It is effectively a collection of different types of tumors, each derived from the various parts of the kidney cell and displaying salient genetic characteristics, histological features, and, to some extent, clinical picture. When it metastasizes, it has the tendency to spread to the lymph nodes, lungs, liver, adrenal glands, brain, or bones. While the exact cause of renal cell carcinoma is unknown, there are risk factors that increase the chance of developing it, such as smoking, high blood pressure, family history of kidney cancer, and obesity. The chance of developing renal cell carcinoma increases with the age, and males have double the chance of having it compared to females. In a lot of patients, this cancer may not produce any symptoms for most of its course. Only about 10% of patients present with the classic triad of flank pain, blood in the urine, and lump in the abdomen. Other signs and symptoms may include unexplained weight loss, fever, night sweats, weakness, fatigue, nausea, and high blood pressure. Renal cell carcinoma is associated with a number of paraneoplastic syndromes, which are conditions caused by either the tumor hormones produced by the tumor or by the body's attack on the tumor. In about 20% of these patients, paraneoplastic syndromes are present, such as high blood calcium levels, high red blood cell count, high platelet count, and deposition of amyloid protein in one or more organ systems. To diagnose renal cell carcinoma, signs and symptoms and past medical history play significant roles. Based on the symptoms and signs, a range of biochemical tests are considered to provide sufficient diagnostic clues. Kidney imaging is vital, mainly consisting of ultrasound, CT scanning, and MRI scanning of the kidneys. Biopsy of the suspected kidney mass helps confirmation of the diagnosis. To evaluate the extent of cancer spread, PET scanning is the standard imaging modality. The therapeutic approach to renal cell carcinoma is guided by the stage or degree of tumor spread, pre-existing medical conditions, and overall health and age of the person. The principal treatment options for renal cell carcinoma consist of surgery, immunotherapy, and targeted therapy. Partial or complete removal of the affected kidney is the standard treatment for localized renal cell carcinoma. Immunotherapy, or biologic therapy, works by boosting the body's immune system to help destroy cancer cells. Cytokines are the artificially engineered versions of natural proteins that activate the immune system, and the ones most often to treat kidney cancer are interleukin-2 and interferon alpha. The targeted therapy works by blocking growth of the new blood vessels that nourish cancer cells or downplaying important proteins in cancer cells that help them grow, or both. Clinical response rates with chemotherapy, either monoagent or combination, are usually less than 15%. Renal cell carcinoma is not very sensitive to radiation, and radiation therapy is more often used to palliate or ease cancer symptoms in case of cancer spread. For more information about list of expert doctors, hospitals, and on
I think it's a truly exciting time. I mean, bladder cancer has been pretty much neglected for decades. We only had cytotoxic chemotherapy that had some modest efficacy, I would say, in patients, and now we are witnessing a true revolution with the approval of 5 immunotherapies. We're still, I think, working our way through in how to best identify patients who may benefit from these therapies and how to improve these therapies. But I think we are witnessing very durable responses in a subset of patients who can benefit from these therapies for years with really sometimes minimal side effects. I think this is truly gratifying for any medical oncologist. So kidney cancer has always been kind of like a immune responsive tumor. It's really the only other cancer where we have essentially old-fashioned immunotherapy a la high-dose interleukin-2, similar to what we use in melanoma, approved with long-term benefits. So since November 2015, we have nivolumab approved, a PD-1 inhibitor, and we do know that we can induce very durable responses in a small subset of patients, around 21% of patients. However, simply speaking, it's not enough. And I think the future is going to be to look at combination therapies. This will come forward in the short term, I would say, in 2 different flavors. One is the combination with VEGF inhibitors, and the other one in combination with another immune checkpoint inhibitor called CTLA-4 inhibitor, or Yervoy. And I think we will witness in a very short amount of time how the first-line therapy for kidney cancer is going to be transformed. It's going to be driven by immunotherapy, truly.
So the things are clearly evolving for several years now, but especially since last ESMO, where we had the results of nivolumab versus everolimus randomized phase 3 study, which demonstrated that in patients who fail 1 or 2 VEGF-targeted therapy, there is a role for IO, immuno-oncology, and namely nivolumab. It is important because this is changing one of our standard of care, and since last year, this has been implemented in all the guidelines. What is important at this ESMO is that we're starting to have more information on which will be the next step in terms of combining those agents, for instance.
Applications in medicine. Immunotherapy is the use of medicine to boost a person's own immune system to recognize and destroy cancer cells more effectively. Several types of immunotherapy can be used to treat kidney cancer. The following types of immunotherapy are being used in the treatment of renal cell cancer: immune checkpoint inhibitor therapy, CTLA-4 inhibitor, PD-1 inhibitor, interferon, interleukin-2.
What is immunotherapy? Immunotherapy is a treatment that helps the immune system fight cancer. Unlike other treatments that target cancer cells directly, immunotherapy works by boosting the immune system or helping it find and kill cancer cells. Immunotherapy works better for some cancers than others. It is a standard treatment for certain types of cancer, and it's being studied in clinical trials to see if it might be effective for many other types of cancer. The immune system is your body's natural defense system. It's made up of organs, tissues, and cells that work together to fight off infections and diseases. The immune system is designed to tell the difference between your own healthy cells and abnormal cells, like cancer. When immune cells find an abnormal cell in your body, the immune system responds to it, usually by removing those cells. But the immune system doesn't always work the way it should. Some cancer cells can hide from the immune system by making themselves seem like normal cells. And sometimes the immune system finds cancer cells, but it isn't strong enough to destroy them. There are different types of immunotherapy drugs. Some make the immune system work harder. Others help the immune system find cancer cells more easily. Immunotherapy drugs are usually given through a needle in a vein. You can experience side effects from immunotherapy. Serious side effects can occur, but for many people, the side effects are mild. That's because immunotherapy is less likely than other cancer treatments to affect healthy cells. Everyone experiences side effects differently. To find out more about immunotherapy and if it may be an option for you, talk to your doctor. The Canadian Cancer Society is also here to help. Visit
Immunotherapy is an exciting area of cancer research that is changing the way we think about cancer treatment. Immunotherapy works by using the body's immune system to fight cancer. The immune system is a complex network of organs, tissues, and cells, and the substances they make. Immunotherapy uses different ways to boost the immune system to do a better job of killing cancer cells. This video describes one type of immunotherapy that uses immune checkpoint inhibitors to treat cancer. T cells are a type of immune cell and are powerful weapons the immune system uses to fight cancer. Immune checkpoints on cell surfaces help control an immune response. Usually, immune checkpoints keep T cells inactive, that is, in an off state, until they're needed. This keeps the T cells from harming normal cells. Cancer cells can take advantage of these checkpoints to switch T cells off. This keeps the cancer cells from being killed. Immune checkpoint inhibitors are drugs that block the checkpoints. This frees the T cells to attack the cancer. Immune checkpoint inhibitors are an effective way to treat some types of cancer, but they don't work for every patient and can cause serious side effects. To learn more about immunotherapy, visit Immunotherapy is an exciting area.
Pros and cons. Pros. Immune checkpoint inhibitor therapy can be used to treat some patients with advanced renal cell cancer that cannot be removed by surgery. Cons. RCC is a fast-growing cancer and often spreads to the lungs and surrounding organs. Cancer treatments can cause side effects. Issue applied in medicine in Ecuador. Renal cancer constitutes 2 or 3% of all malignant pathology. Of these clear cells, renal carcinoma corresponds to approximately 85%. Due to the fact that this histopathological type is resistant to chemotherapy, new molecules are used for treatment worldwide called target therapy, with significant results of progression-free survival and overall survival. Sunitinib, a tyrosine kinase inhibitor, is part of the era of target therapy available in Ecuador. Conclusion. Immunotherapy has changed the landscape of management of metastatic RCC. The optimal treatment sequencing is not clear yet. Thank you very much.